We meet the third Thursday of each month. I'm going to get this together. My name is Maria Ortiz. I'm co-chair of this committee along with Joe Restuccia. Per the governor's order, we have been meeting remotely, and this meeting is being recorded and currently live streaming on YouTube. It'll also be accessible after. The agenda and the materials for tonight's meeting are public and can be viewed on the Manhattan Community Board 4 website. I encourage you to sign up for the Community Board 4 e-blasts, where you can get the agenda and links to the documents for the meeting beforehand. If you've never been to a meeting and this is your first time, 2 important things to know. After, what happens is we have a presentation. After each presentation, first the committee will ask questions or make comments. Then members of the public or attendees will speak and comment or ask questions. Subsequently, the discussion goes back to committee. On some agenda items, committee members vote to write a letter of support or make recommendations. When it is your turn to speak, meaning the public or the attendees, please raise your hand. There's a raised hand button on your screen. And if you're calling in, I don't know if anyone's calling in, you have to press *9 to raise your hand. Is anyone calling in?
I don't see any call-ins, Maria.
Oh, okay. All right. So I will just jump right into the agenda. But if you want to speak, just please raise your hand.
I'm going to first put the agenda up so people can see it on the screen.
Oh, that's great. Thank you. I was going to say
Yeah,
the
no
first
problem.
item on the agenda, so you can see harm reduction and overdose prevention by DOH-MH. Next, we're going to talk about the Aladdin Hotel, then talk about the proposed applicant guidelines and family hotel closures that should be there, as well as old and new business.
And I want to note in the committee update for the Aladdin, Maria and I attended a meeting this morning with the Mayor's Office of Contract Services. So we're going to amend the agenda slightly to also speak about the proposed drop-in center at 771 9th Avenue at the same time, because they both were discussed this morning.
Yes.
Hey, Maria, and then the last piece to note, our agenda is packed tonight. So Maria will be handling the first item, and we will allot 20 minutes for this, please. So we ask both the presenters to be clear and brief, and then our members to be very succinct. We have a lot of items to deal with, especially the second one, which is a whole change from where we were last month. I ask all the members of the committee to please turn your monitors on if you can, so the public can see you. And one bit of housekeeping business with introductions. We have a new public member on the committee tonight, Travis Rogers from West 42nd Street. I'll ask him to introduce himself in 1 second, but go around the room first and just committee members. Hector. Intros.
Hi, I'm Hector Vasquez, and I've lived in Chelsea over 25 years.
Sabrina.
I'm Sabrina Reveron. I've been Hell's Kitchen for almost 6 years now.
Leslie, followed by Dolores.
Leslie Williams, Hell's Kitchen for 45 years, but I'm only 39.
Hell's Kitchen, I'm Dolores Rubin. That's actually the first part. And I've been there 52, 53, if you count when I was in the womb.
We're going to go to Paul, followed by JD.
Yeah, Paul Ames, in the neighborhood since 1981, public member.
Good evening, everybody. Jean Daniel Nolan, Hell's Kitchen, decades, many years.
Roberta, followed by Katie.
Sure. Hi, my name is Roberta. I'm a Chelsea resident for only the past 5 years, but I've been a lifelong New Yorker born in the Bronx.
I'm Katie Stokes. I have been in Chelsea for 23 years. I'm glad to be here.
Betty, followed by Josephine. You must unmute, Betty, as always. There you go.
I'm Betty McIntosh. I live in Chelsea, in Penn South, for a long time.
Hi, I'm Josephine Ishman. I'm a Chelsea resident for about 12 years.
And then Maria, followed by Joe. Then we'll have Travis do a quick intro. Maria?
Maria Ortiz, Hell's Kitchen, born and raised in Chelsea and Hell's Kitchen my whole life. So that's 43 years, 43 years.
And Joe Restuccia in Hell's Kitchen, only 41 years. let Travis, you can tell us a little bit about who you are, why you want to become a public member of the board, and your interests.
Thank you, Joe. My name is Travis Rogers. I have been a resident in Hell's Kitchen for the last 10 years. I am a lawyer by trade. I'm also a social worker. I currently am the Chief Equity and Strategies Officer of a nonprofit here in New York City that provides social workers and 360 services to schools across all 5 boroughs. I'm very excited to join this committee and be a member of the community board, as I'm highly invested in our community, the needs of the community, and where we need to go for the future, from everything from diversity issues to health and safety issues. So I'm fully committed and invested in the community. I don't want to live in any other neighborhood other than Hell's Kitchen. I think it's the best neighborhood in all of Manhattan, in all of New York City. No offense to Chelsea residents. And so I just want to get to work. Thank you.
Thanks, Travis, and welcome. So
Thank you.
Maria, turned over to you to manage the section about harm reduction presentation from DOHMH.
So Michael and Pauline, I see that you're both here. Unfortunately, we didn't get to have a conversation beforehand, which I usually like to do. So I'm just going to ask if you can give a brief intro about who you are, your role, where you work, and jump into the presentation.
So hi, yes, my name is Dr. Mike Rae. I am the Acting Executive Deputy Commissioner for Mental Hygiene at the Department of Health here in New York City. And so I'm here to talk today about the overdose prevention centers and just discuss kind of what's happening right now in the city, as well as give you some background and information about the services and history as well.
Okay. Thank you. And Pauline?
Hi, I'm sorry for the confusion. This is actually Jackie Riley. I am on the team of the Intergovernmental Affairs team. I logged in as Pauline in order to share my screen for Michael's presentation. So I am here to assist him. So if we can get started, do you mind if I start sharing my screen?
Thank you. Right ahead. Nellie, make sure she has the ability to do that.
Yes, she does.
Okay, perfect.
So while Jackie's pulling that up, I just, again, this is really about kind of OPCs, the overdose prevention centers, and kind of what they really mean and how they can really impact New York. We'll go to the next page. So, we've been talking about OPCs and the opioid epidemic for some time now. And people are asking, well, why now? And I think this graph right here really clearly shows why now. 2020 was our highest year on record of opioid overdose deaths. Our preliminary data for 2021 shows that we are on track to actually beat this. So we see like a very clear need for now. And so next slide. What we see, this is the map of the city. Folks have seen this probably in many different permutations. This particular map looks at the city in terms of overdose deaths. And what we see here are, the highest rates are in the Bronx, in Harlem, and parts of Staten Island. But there are many problems across the city in general, many areas where there's a need for intervention. But this, interestingly, we look at this map and you cross it with race and other social determinants and health outcomes, you see this a similar pattern to this. You see the blackest and brownest areas of the city with the worst health outcomes and social outcomes. And that's both physical health and behavioral health, or substance use and or mental illness or health. Next slide. So this is the front page. This is the kind of opening that came on with the New York Times. Our first OPCs opened in East Harlem and in Washington Heights on November 30th. We put this up there because it partly shows some of the like one of the booths that's there, but also wanted to kind of we want to start this kind of conversation around really debunking myths and kind of changing language in order to really think about this work a little bit differently. Many places are calling them drug injection sites, and we are intentionally talking about them as overdose prevention centers. There's much more that happens in these spaces outside of drug injection. In fact, we use providers who are offering other services prior to this and help and work with them to kind of add to their menu of options. But there are many different, there are various kind of harm reduction strategies that are being utilized in these centers, and it goes well beyond the drug injection sites. So we understand that's kind of the new and kind of interesting thing to people are kind of holding on to. But there are many. These are folks who have been offering services and harm reduction services in the past. So just a little bit of a reframe there from drug injection or supervised injection to really overdose prevention centers. Next slide. If you look at the bottom here, you see a picture of the one of the first in Vancouver. And people are oftentimes kind of taken aback because they'll look at it and say, we thought we were going to see a bunch of people kind of laid out, and like, no, these are hygienic, professionally supervised and run facilities where people can use drugs. And it emulates kind of a clinical setting. It is a clinical setting. They provide education, equipment, oversight of drug consumption practices. And they provide also these connections to people with who have concerns or need for connection to health, physical health, mental health, substance use, or social services. And so they offer a wide range of these services. And this is consistent with our model as well here in the city. Next slide. So what do we know? We know that science really supports the benefits of OPCs. We know that, there are 30 years of data looking at OPCs around the world. And what we see are reductions in overdose deaths in neighborhoods. We see a reduction in public drug use and syringe litter. We see a reduction in drug-related crimes, and there's no increase in serious crimes. These are individuals who are not in contact with other essential health services. So it provides that other kind of space for folks to kind of connect to appropriate health services. We also see an increase in people's use or utilization of primary care and drug treatment services. So the science is definitely behind this. Next slide, thank you. Okay, that's fine. Sorry, Jackie. So there are over 60 jurisdictions worldwide, over 100 OPCs. Like I said before, we have 30 years of evidence that shows that they are effective, and there have been 0 overdose deaths. 0 overdose deaths at OPCs. To me, that's what this is really all about in the end. It's about saving lives. And we're seeing from the data worldwide that we are saving lives. Even in our own data here, we are seeing many people, lots of people per day, and there have been 0 deaths. We have intervened multiple times, many times, to prevent someone who from overdosing. And we've seen widespread support throughout the country, from Philadelphia to Seattle, San Francisco, Rhode Island, and New York State is also supportive. And this doesn't include Los Angeles as well. Many different jurisdictions are really trying to figure out, how is New York City doing this? How does it look? How effective is it? And we can say just from our preliminary data that we are definitely, there have lives, that their lives have been saved in this space. Next slide. So I wanted to also include a quotation from someone who uses drugs. They said, having a place to go where there's others around me, it could be uplifting and not only save my life if I were to overdose, but save my life in other ways. I think one of the critical pieces of this work has been the way that we expect and hold folks to standard in terms of treating people like humans, humanity. Through these services, people are treated like humans, like people, like, you know, fathers, mothers, aunts, uncles, all are, you know, they're like people. That's all I can say. To me, that's extremely, that's really the first part. But in the end, we are saving lives here. And I think that is where we kind of are kind of very excited about this work, and really would like to see this in many different areas across the city, because there is need across the city. Next slide. Discussion.
You can take down the screen, Ellie. Okay, opening it up for committee members. Dolores, followed by Katie, followed by JD.
A few questions. Is there any part of this program that works towards counseling to try to help folks wean themselves? That's the first question. And then also, how is outreach done? And are you partnering with any other agencies or organizations to try to help people who may have been either reported as habitual users or either observed, to try to bring them to your centers? So the first question is about actually working towards weaning folks from their addictions. And the second one is, how do you do outreach, and who do you partner with to do that outreach?
Excellent questions. The first question, yes, I mean, on site, there are counselors, there are medical professionals that are there. The point is not just to kind of go in and use drugs, but it's also get yourself connected to the kind of multiple services that are available in your neighborhood, and actually on site as well. And kind of one of the main tenets of harm reduction is, you know, you kind of build this relationship with people over time. These people are coming back in over and over and over again. And, you know, may not be the first time, the second time, the 10th time, but maybe that 11th time, they come in and they're like, okay, I trust this person. Like, they've been here the whole time. They've been supervising, make sure I'm safe. They've helped me out. And then their people become more warm to kind of other services. I think in terms of outreach, this is two-pronged. So I think one of the pieces is, you know, the centers do offer outreach services. So they have outreach workers who kind of go around the neighborhood. You know, some of the concerns have been around like syringe litter, right? So for this particular provider, if there's syringe litter that people see, they can call the provider. The provider will go out and pick up the syringe litter, right? You know, they are a resource that exists for people to use even outside the four walls of the center. That's kind of the first piece of outreach. I think it's important. The second piece of outreach that is also critical is that the city has joint operations that's works where there's DOHMH, there's DHS, there is health and hospitals who are partnering with the centers or the sites to really make sure that the area, you know, ushering people to the space, educating individuals around kind of its existence. So there is like that very kind of strong kind of coordinated intergovernmental, you know, coordination of services with partnering with the community-based organization.
Katie?
Thank you,
Dr.
Dr. Rae.
Yes. Katie, followed by JD.
Thanks. This is such great work. And as you say, it's so important, and it may take several visits for people to feel the trust and be able to sort of establish those connections, but that's great. I was just wondering, sort of very specifically right now, how many OPC sites are there?
Right now in New York City, there are 2 sites. There's one in East Harlem and there's one in Washington Heights.
And with the expectation of, is there like a plan to try and roll out more?
There is no specific plan in terms of like, where they will go or who will do them, but we definitely are very supportive of expanding the services across the city. We want to make sure it's done in the right way, in a thoughtful way, in a transparent way, as much as So we would like to see this kind of expand across the city, yes, because there are multiple areas across the city that need these services.
And then my last question was about how many people do they see on average a night?
Our data is still very preliminary, but they're, they in the first 7 days, I should have this number in my head. I think about 700 people. 700 visits. So they're that's 700 visits, not people, not individuals, because people may come back, several times, but they're seeing the uptake is not an issue at all.
Wow, thank you so much.
JD followed by Hector.
Yes, Michael, JD here. Fantastic job. Very important stuff. I have 2 questions. One is a clarification. I think when you started out, you were talking about opioid deaths in the city.
Yes.
And that's also in that statistic you showed us, that also includes drug-related deaths as well as opioid deaths. Is that correct?
Injectable drugs. He meant injectable drugs versus non-injectable.
Those are opioid overdose deaths.
Okay. The second question, Michael, this is a presentation that's very positive and very good, and there's not going to be another presentation that may have some counter arguments. So let me play the bad guy here. Although I'm on your side, Michael, but let me play the bad guy because you're coming before a community. So two parts. Is there a downside to a community with one of these sites? I know you're going to say no, but just in case, just let us know. And secondly, I believe that drug addiction is a terrible physical problem. It's not a matter of willpower. It's very difficult to solve. Are there any statistics about the people who come to you who eventually are able to get off drugs?
For us specifically, we don't have that data right now because we'll be open only for about a little over 2 weeks. But the literature is pretty clear that that there are reductions in like I said, syringe litter to the neighborhood, kind of public and reduction in public drug use, and people are getting connected to the care that they need. So we expect it to follow that same model, and we're closely monitoring that as well. At this time, we don't have the data to really support that because it's such a new program. But we do look forward to being able to really present that data because we're very confident that it will happen.
Okay, Michael,
let's go to Leslie. I forgot. I missed that. Leslie had his hand up first, then Hector.
Oh, no problem. Very good presentation. I just had some questions. I know you just started out, but will there be linkage to workforce development and education and mental health along the way as you continue on with the project?
So there are links to mental health services at the centers. I cannot give you the answer to the workforce development piece at this moment, but I think that's an excellent idea in terms of. I think our philosophy is always around connecting people to all the different social kind of pieces, right? Things that kind of keep you back socially, and workforce development obviously is a huge piece. We're dealing with people who have lots of financial kind of insecurity. And oftentimes they're homeless and don't have access to workforce development resources. So I'm gonna keep that in the back of my head, and I will respond to that piece specifically. But there are later on, there are connections to mental health services at the space.
Good. And finally, to add to what you just said, also housing. is also
Housing, yes.
part of this.
Yes.
Yes.
Now, I can say with assuredness that with assurity that they are connecting people to housing as well. They have a working relationship with yes, to housing.
Thank you.
Yeah.
Hector, followed by Paul.
Hi, thank you for the presentation. Very impressive work you're doing. I have really kind of two questions. As far as the operations of the clinic, I mean, viewing from the photos that we saw, that was a photo of a clinic in Canada. Was that correct? Did I heard correctly?
Yes. There were two different pictures. There was the long a long row that was from Canada, and there were actually three pictures. There's the long one from Canada, and then there was like one booth, and then there was one that was set back with supplies, looking at two or three booths. And those latter two are the actual center in East Harlem.
Oh, okay. So from the setup, it looks like I guess the user would sit there with some supervision, do their business. But I mean, on average, how long do you think a turnaround like this would happen? I mean, don't you have people passing out there, under the influence, and then they're there for several hours, or how would that work? I mean, do they have a room for them to lay down in afterwards, if it comes to that, or what do you guys do? I'm just trying to picture the operation.
I think that's the beauty of this of the work that's done there. They're able to catch people before they even get to that space. So because they have the mirrors, if you want to pull, we can send you a picture again, but there's a mirror. So the person is using in front of the mirror, that allows them to see the people behind them, as well for the person behind them who's supervising to see kind of if they're nodding. So they're not even at the point where they're kind of falling out, but they can kind of catch them when they're in that space and kind of bring them back in a much more kind of less intrusive way. I'm not sure if folks has ever seen someone who've been administered naloxone, kind of the nasal spray, but it can be a very kind of, because there are people who are kind of on their way, lips, blue face. I mean, they're in that space, and when they wake up, they're very startled. It can be very harsh for folks. In this space, they're using kind of less invasive procedures because they can catch them earlier.
Right, but my question is, they're doing their drugs there at the location, and as as we've all seen in the streets of New York and in other areas, I mean, some of them pass out, some of them get into that zone where they're incoherent, and they do all sorts of behavior. How do you deal with that though? And obviously, it's very time consuming, so you're going to have the person there for maybe several hours. Am I correct?
So I think this kind of break this down a little bit. So I feel like there is the kind of catching people before they get to that space, and there's also like if they get to that space, then what? And they have access to all the same services that we all have access to. So they will call 911 if it comes to that space, but they've used kind of gradual kind of interventions in between. Then it's like that versus them being on the steps of the stairs of the train with nobody there.
Gotcha.
So it really is kind of
right. And I guess my question is the neighborhood that they're in, obviously. And I know hopefully if this is successful, which I think it will be, you plan to open up some more centers. Now that raises the question of neighborhood safety. Obviously, when they leave your center, obviously I don't think you guys feel any real responsibility other than some people going out and checking out, the immediate neighborhood to see if everything's okay. Nobody's hanging out in the neighborhood doing something they shouldn't be doing after going to your clinic. So my question is, what do you do about combating some, bad behavior that a lot of the neighborhoods are afraid is going to happen when one of these centers open up in their neighborhood?
Yeah. I mean, I think at this point we refer to the research. The research doesn't bear that, these centers, placement in neighborhoods poses any risk for increased crime. That is in these the way we have worked it here in New York is that we're making sure we're adding to menus of services that of people that of partners that are already there, right? Who are already working in that space. That's what we've done with these two centers. And so these are what they're reporting is that really these are the same people that they've been seeing for a very long time.
Yeah, I get that. I get that. But my issue is that, you will have some people who use, on a regular basis, and there's some poor behavior that comes from these folks. When they leave your clinic, you're no longer keeping an eye on them. Who's to say they don't go outside and commit a crime, or they get high even more outside in the street? You know what I mean? And then that really brings down the neighborhood, and then you have negative feedback on your centers, and maybe you won't have any more opened up or welcomed into the neighborhoods. You see what I mean? I mean, you have a very worthwhile program, but I'm afraid that if you guys don't take it a step further and ensure the safety and the comfort of the neighborhood that they're in, you're going to lose support for this.
No. I mean, I would say do not fret. I know that, I mean, I think that, we have, these places have relationships with the community. They have relationships with the community already. And we're not seeing kind of, I think first it's important to like do a little like destigmatizing, right? And saying it's not about, oh, these people are going to leave there and do all these like, break all these laws. I don't think that is, I don't think that's a true or accurate or helpful narrative.
No, I understand that, but it only takes one individual or two to screw the whole thing up for everybody else. You understand what I'm saying? And if you don't take action,
And I think it's important for us to say, oh, this is one person, but this could have been another person who wasn't actually at the space as well, right? Like, I think one of the tenets of harm reduction is that people who are using drugs are going to make decisions about whether or not they use drugs. And it has nothing to do with whether or not they're actually in a center that is actually, given them supervised, supervision. They're not providing drugs for them. So they're using the same drug that they'll be using on the street. They're just using it in a supervised place. So I think there's like, this idea that, oh, you're gonna have all these people who are using drugs coming to the neighborhood. And what we're seeing is that really people don't really travel far. No one's gonna travel from the Bronx to, Midtown to go to the OBC center, OBC. They're gonna go to a place that's close to where they use in general. So I think
I want to be mindful of time. So I want to I really would like to go to Paul and then Roberta. Okay. Paul, and please keep it brief. You're on mute, Paul.
Unmuting. Yes, I'll be brief. Doc, you probably know we had 2,000 or so homeless folks deposited in our neighborhood over the last 2 years, and one of the problems that I guess we should have thought of it earlier, but I didn't hear much mention about it until it happened. They attracted a large number of drug dealers, unfortunately, sadly. I'm with the folks who want your idea to work and be replicated. Everything I've ever read about it sounds like it should work. It's common sense. But have you had any experience dealing with the folks who are, the folks who are peddling the drugs to the folks who take them? That's the essence of the neighborhood question that I think is on a lot of people's minds. I'd love for this to work. I wish you well with it. But what about the folks who are just there to make a buck off the folks who are taking drugs and have been for a long time? What's your experience there?
Yeah, I mean, I think, that's something, we are constantly monitoring that. Part of this joint operations, also NYPD is also involved in that joint, operations as well, to make sure that, people always use this term like quality of life. I think that's like a really bad term, but that's like what people understand. It's like how things are in the neighborhood, right? Like that is what people are referring to. And we are constantly monitoring that through our joint outreach teams with DHS, DOHMH, health and hospitals. We are monitoring that stuff.
Let's go to Roberta and then Travis.
Thank you.
Sure. So I have a few questions and I'll try and keep them brief. The first, I was curious if when citing the facilities that currently exist in Harlem and Washington Heights, if there's a process of working with the community in order to cite those, and if there would be a similar process in the future for future sites.
Yeah, no, so our intention is always to communicate with folks. That's what we're here talking about it right now. I think, we like to see this expand across the city. And so we are always, our intention is to be as forthright as possible. And, absolutely, we want to include folks in this process.
Question I had, I'm not certain if you'll be able to answer it, but I know that the federal legal environment is not particularly supportive of, or has historically not been particularly supportive of these types of centers, if there is any concern for the future of them being shut down depending on who is in charge in the federal government.
I mean, if only I had a crystal ball. I don't think, right now, I think we feel confident in our support.
Okay. Do you appreciate it?
Travis? Sorry, Travis, and then Dolores.
Oh, I mean, Joe, Paul actually asked my questions. That's
okay.
Can I just jump in with a question really quick?
Oh, Maria, sorry, yes.
For Dolores, yeah, because I'm sorry, I have a bad habit of not raising my hand. Just really quickly, Michael, I know this might be a big kind of question. I don't know how well you can answer it, but if I heard you say earlier, if people aren't going to travel from downtown to uptown to go to an OPC site. So I wonder why the locations were selected where they currently are when communities of color are impacted. I believe I heard you say mostly in Staten Island and in the Bronx.
We're Staten Island, East Harlem, and the Bronx. Those were the kind of the darkest shaded colors. I mean, some sections of.
You did say East Harlem.
Yeah, East Harlem and the Bronx. But Washington Heights also has concerns. We went with providers who were able to kind of stand it up, who had trusted relationships with the community, who wanted to kind of do that right. So, we would love to expand to other areas that are not just even the dark blue, but like other areas as well.
But you didn't go. But there's no site in Staten Island.
At this time, no, there is not. Like I said, we wanted to go with the providers who were ready to go, who had the ability to build this this operation up in a way that was solid. But we would definitely be open to doing this across the city, not even in many different areas.
I'm kind of curious about why, but we can talk more about that another time.
Okay.
I can reach out to you and have a different conversation. Yeah, that was it. Thank you.
All right.
So just a few thoughts to try to conclude. One is, as you know,
people from the public.
Sorry, public. I apologize. Okay, so I'm sorry. Let me just make a few notes. So, Dr. Mike Rae, first, as you know, every social service lives and falls by how well it's managed and what kind of operators there are.
Thank you.
Unfortunately, our district has been really suffering from poorly managed social services, and that creates the lens that we bring to this all the time. There's the great operators, but then the bad operators are the ones that create all the issues and create the impression for everybody else that this is whatever it is going to be a problem. So, for example, we have a methadone clinic on West 37th Street and 8th Avenue that is horribly managed. Yeah. They do nothing outside of their doors. And in fact, folks who are going to get the methadone there are coming out and selling, and there's a whole activity happening with drug activity that the methadone clinic is not managed is drawing. The issue when you say quality of life, I'm sorry, that word it's a word we use, but it's actually our lived experience. It's not just research. And because we've had, unfortunately, horrible management by DHS in the social service area with the COVID hotels and a number of other facilities, that's what we are concerned about before any expansion of social service facilities happens in our district. When the ones that are here are poorly managed, they're destabilizing for blocks. The ones that are well managed, you don't even see them because they're well managed. That's the whole issue with it, right? So I remember in general for us on the West Side, we've been so welcoming, but the trend has been feeling in the last year and a half, welcoming has translated into we're burned because everything is poorly managed and it can just literally be dumped here. So that's an ongoing threat in our community. And it's really creating problems for us to welcome other social services because we keep hearing the same. The research says, or there will be no problem. And in fact, there are terrible providers. I just wanted to share that with you to understand it's making us crazy here and you have to hear about it in order to move through any discussion of any sort of services like this.
Dr. Mike Rae, my second question, Joe reminded me, I was actually going to ask who the providers were or who is the provider.
On Point, NYC.
Okay, thank you.
They are the New York Harm Reduction Educators and Washington Heights Corner Project.
All right, thank you.
I thank you for bringing that up, Joe. I think that is important. I think that is definitely not lost. I think that we definitely need to make sure that the providers are good partners, right. So I think that is definitely something that we thought was kind of an impetus for us going with On Point, because they are good providers, they are good neighbors. And I think, that's a larger question around like, how do we kind of make sure that providers are also good neighbors?
Right.
That's why I feel like it's kind of the crux of some of the stuff that you're kind of bringing up here. And I agree with you.
I mean, I will tell you, Maria and I were in a Mayor's Office of Contract Services hearing this morning, and we had a difficult provider, and just by chance, they were in the same hearing, and they were awarded a $44 million contract for 6 years. Pretty frustrating to hear when they had a hard time operating one facility here in our district. So it's that sort of thing we want to make sure we avoid: transparency, understanding, a knowledge of what's happening. So it's not as if something's chosen and all of a sudden we're reacting. We are so tired of being in the reacting mode. We want to be in the working with the agencies mode to come up with solutions, locations, and things that can work for our district, because we actually know it a lot better than the agencies.
Noted.
Let's go to, from the public, we have Brian Weber, right? Followed by...
Joe, I've already moved them over. It's Brian Weber and Richard Perkins.
So let's go to Brian and then Richard.
Hi, thank you, Joe. And thank you for your comments, Joe. I actually didn't think that was a magnificent presentation. I found it very problematic. You are now rebranding essentially what has been pitched as supervised injection sites for quite some time now. And I appreciate why you're rebranding it. Your efforts are to destigmatize this as an issue. In our community, we deal with opioid addiction every day. And just a little bit of background about me: I'm a public member on Community Board 4. I live on West 36th Street. And between West 35th and West 38th Street, between 8th and 7th Avenue, there are 8 substance abuse programs, one being the methadone clinic that Joe mentioned on 35th and 8th, the others being various harm reduction centers. I know that one of those harm reduction centers, and I believe he's on the call now, Richard Perkins from Housing Works Positive Health, has been advocating vociferously to open a harm reduction site at 37th and 8th. That is incredibly problematic for the community that lives here. In addition to being a public member, I am the co-chair of my block association. I'm also the co-president of the Midtown South Precinct Community Council. Our section of Hell's Kitchen is besieged by narcotics activity. We have an incredible number of, and Joe alluded to this, during the pandemic, we had a disproportionate amount of COVID hotels located in this area. A lot of the individuals in those hotels were struggling with substance abuse issues. Anecdotally, Black Veterans for Social Justice, which was on 36th Street, told me that 40% of their occupants were heavy users. What followed was a wave of drug dealers. It has expanded dramatically along the 8th Avenue corridor between Penn and Port Authority, and it preys upon the individuals who are coming on a daily basis to the methadone clinic and the harm reduction centers. We have syringes all over our sidewalks, and I am deeply troubled by this sentiment that the research shows. The research doesn't show. This is a pilot program in New York City. The 2 sites that were opened in Harlem and Washington Heights were not welcomed and vetted with the community. In fact, they were sprung upon the community, and Reverend Al Sharpton and his Action Network had a massive protest over the weekend in opposition to these clinics. So I think that you're painting this in very rose-colored glasses, and we're, as a community, I think just springing this on us is really problematic. So if you're going to bring these into our community, you have to vet the locations first, and you can't just say, oh, this is good within the confines of these walls. Because what we are seeing on the streets on a daily basis with this concentration of harm reduction facilities is not meeting the same sort of desired goals of those harm reduction facilities. And that's all I have to say about on the matter. I mean, I think this is a deeply troubling presentation, though.
Thank you, Brian. Richard?
Okay, thank you all for sharing. This is Richard with Housing Works, indeed. One of the concerns raised in the community, and I'm a community member here as well, is the troubling nature of what we encounter in the streets daily. I'm not going to deny that. We also have to understand the entire world has been through time-altering changes because of the pandemic. A lot of social services were shut down. A lot of people came from outside of New York City to seek the social services, such as us, that were some of the few ones that were remaining open, that were providing substance use treatment for people. There were also people who were brought into the hotels. Again, that was a circumstance through DHS. And obviously that brought a lot of undesirable circumstances to the neighborhood. We do not deny that. The reason we are promoting a harm reduction center or an overdose prevention center in this community is precisely because of these changes, precisely because of the number of people using in the streets. We're out there daily with Housing Works cleaning up these syringes. We have trained the Garment District and Hell's Kitchen Alliances to work with us to safely dispose of syringes. We do not condone people using in the streets. We do not promote drug use, but what we do is respond to what is going on in the community. And choosing to believe the research or not, and a lot of people will say that the research doesn't translate to what we're experiencing here in New York City because it's a pilot program, it hasn't been tested. Unfortunately, there's also research that counters that. There has been research, and I'm happy to share the articles later, done when there were unsanctioned overdose prevention centers in the United States that showed conclusively that interpersonal crime is reduced in areas where overdose prevention centers are found. Observed use is reduced. And here's the thing. We are where we are now because of the DHS debacle, because of everybody coming into Midtown, because of the shutdown of all the services. And our goal is to help alleviate that. Again, the time after time, and full disclosure, I am a former injection drug user. And I can tell you, we're not traveling anywhere else away from our drug supply, away from our community to use drugs. People are using right now in the streets and dying right now in the streets, in front of you, in front of the community, in front of your children. I don't want to be accosted by people using drugs at the street. I don't want to trip or fall or hurt myself with needles. What I do want to see is people, especially the most disenfranchised of them who are not engaged in any services whatsoever, to be engaged for the first time in any kind of service. And uptake in services such as harm reduction, even full recovery, detox, increases with every single overdose prevention center that is open. Interpersonal crime decreases. The crime right now is bonkers, and I will agree with that. And the community is extremely uncomfortable to walk around at night, during the day even. But the thing is, people are looking at overdose prevention centers as a center that's going to draw more people. There's going to be a honeypot effect. It's going to continue to negatively impact a district when study after study after study, including studies in the United States, have disproven that theory. And that's all I have to say. We are looking at this as a harm reduction intervention for the community, not just for users of drugs, but for the community as a whole. It's a proven public health benefit. It's proven to save on average $4 million a year in each city that's had one of those, and public health costs and unnecessary calls to medical services and unnecessary police activity. And it decreases instantly through outreach opportunities like we have. We do outreach twice a day for 3 hours each in the community. And those people that you're seeing, that you're tripping over in the street using drugs, the needles you're tripping over, we're pretty confident that problem will be substantially reduced.
Thank you, Richard. Right. Thank you, Richard, very much. So I just want to note for everybody that the issue about the research, we are in the densest city in the nation. These programs have not been done in our level of density. And I think DOH should proceed, see how things work out, come back to us in the future, talk. But I want, again, caution DOH, because of the horrible problems we've had with other agencies who simply do not disclose siting of programs until there's a provider in place or a location chosen. We ask you, we implore, if you want to be welcomed ever again in our community, come and talk about what an idea is prior to citing it or funding it. It is as if community doesn't exist at all, but the social service needs exist solely in a vacuum. We want to get past that because we've never worked like this. For decades, we have integrated social services into our community. And we ask you to be part of a new administration and working in a different way than the past 8 years has been for us. We really appreciate your coming tonight, hearing us out, and also us hearing you. Thank you very much, Dr. Mike Rae.
Thank you all.
Okay, folks, we're gonna move on to our next item. Are we ready? Yes. So our next item is the Aladdin 317 West 45th and the proposed drop-in center at 771 9th Avenue. Maria, do you want to just give a quick update of our meeting this morning, and then I'll pick up on where we should think about going forward in the future.
I'm not sure what to say about it.
Sorry.
You're talking about 10 a.m.?
Yeah, let me just frame the two locations. Okay. So the first is the drop-in center, which we've heard the board has acted on, and we specifically asked DHS and Urban Pathways to come to us to try to work for an alternative site somewhere in our district that we supported the idea of a drop-in center, but not at this location. The second item is the Aladdin Hotel, 317 West 45th Street. Very specifically, this is a homeless hotel that has been used for shelter for quite some time, and as part of a commitment made by Mayor de Blasio about 5 years ago at a public meeting in which one of us had to ask a question so the mayor could answer it to say what he was doing. And the question I asked was, will you be closing the Aladdin? He answered yes, and we'll be opening a real shelter, not a SRO, poorly managed, horribly managed thing. It was then we found out in September of this year from the Commissioner Banks at DHS that the Aladdin was being closed, and a part of the deal was the opening of the new family shelter of 440 West 41st Street. Community Ward 4 was notified about a week and a half ago that the Aladdin would stay open with an extended contract for another 5 years, operated by both Urban Pathways and Breaking Ground, which made no sense to us whatsoever because it was very specific that it was about to be closed. A lot of discussion about how the building could be repurposed in the future. About 2 years ago, the Speaker's office proposed converting it to a school. The board responded that it's housing, it cannot be converted to a school. That matter has now been dropped and is no longer being considered. And now there's a lot of discussion, what could happen in this building in the future? Irrespective of what happens in the future, today, at the Mayor's Office of Contract Services, there was an approval to extend the use for homeless shelter for another 5 years in the building that also has long-term tenants who have lived through horrible periods of mismanagement. And it is owned by an owner who has benefited dramatically from the per night reimbursement rate from DHS for over a decade. Maria, did you ever run that cab, or was I only the one on that?
No, I didn't.
Yeah,
I didn't.
So I ran the community advisory board for a number of years as we tried to get some. It's a singles hotel, heavy police involvement, heavy drug activity, lots of arrests, stabbing, things thrown out the windows, very, very poorly run. That operator was removed. They were a for-profit operator, which was owned by the owner. Now the new operators operated much better, but again, it is a very old building, poor condition, congregate bathrooms, and you have long-term tenants sharing bathrooms with individuals who are coming in and out all the time. Today, that contract was approved. We were notified this by DHS just last week that it would be on the Mayor's Office of Contract Services. The contract for the drop-in center for Urban Pathways was also approved this morning, making a complete mockery of our whole discussion in the last 2 months with DHS on how we could work together to find a location for this drop-in center. And the contract, I believe, Maria, was a 10-year term?
It was, I think it was 5, but I could be mistaken. I'd have to look at it. I can come back to you.
I think it was a bit longer and it was like 14 or 15 million, something like that. So we throw this out to the committee to discuss because it is endemic of a larger issue we have with the Department of Homeless Services, where it is site, fund, contract first, inform community second. And in our meeting that Maria, myself, Jesse, and Lowell Kern had with DHS last week, we made it clear to them that they have broken trust with our community. There is no ability that we're trying to figure something out together, make it work. Our goal is to engage and try to integrate. And we said they have completely broken trust with us. So I want to put this open in general and talk about what action we might take. Maria, any thoughts as you've been involved in these couple of meetings and talking about it?
The contract term, just want to share, was from January 1st, 2022 through June 30th, 2026, with an option to renew.
The option to renew through 2031 or 32.
Correct. To
Right.
renew through 2030. The contract amount will be, it's almost 13 million.
13 million.
Yeah. I have to say I think the most interesting thing is that we were on the call for a while, or at least I was, for about an hour, and we went through many items. No one from the public spoke except maybe 1 or 2 things. But when it came to this, there was 3 or 4 people who spoke in total. And the main issue that kept coming up really was about the issue of the density in a 2-block radius. And I don't know what else to say about that. So we'll see what happens with the next administration.
Yeah. Katie, followed by Dolores, then JD.
So I was a little confused about the Aladdin Hotel. So it sounds like the previous provider, where there were a lot of problems, they have been out for a while now, or until recent?
They have been out for maybe 2 years.
Okay, so the new contract that was just announced last week or this morning or whenever recently is with what providers?
It's with Urban Pathways and Breaking Ground.
And have they been there for the last year or two?
And neither organization came to the community board to even present or talk about it. Or
Okay,
informed us.
but are they the ones who have been running it for the last year or two?
No, it was closed partially during COVID, and everyone was moved out. And now the phrase is, these are stabilization beds. You don't even really quite know what that means, because it seems as if when DHS wants to get something, they sort of rename the use. There's been so many different named uses for this building. So, it was entirely closed during COVID.
Okay, so this announcement is for 2 new providers or new to this location providers.
They had been there a little bit before, Katie, before it closed for COVID.
Okay, so they were there, it closed, and then are they saying when this would open up or start again?
Immediately, January.
Okay. Okay, but so I was just trying to understand sort of what had happened recently, or so all the problems you were mentioning before weren't with these 2 providers, it was with the old provider, is that right?
No, there were problems that persisted because of the nature of the building. This is it's an old, like a actor's hotel. So they're all shared bathrooms, and the owner has owned it for a very long. This owner has not done major work there. So there's ongoing issues of how the place. There's no common rooms. There's nothing that is conducive toward running it as a shelter in the physical plant. That's one of the ongoing issues with this building.
And none of that was addressed today, or okay.
None.
So it sounds like that's something then that if there's a CAB going forward or something, that those are issues that we would want to address. Okay.
Well, also we have a commitment from a mayor who said this facility would close because it was such a poor fit for the use and the block. So I'm not going to forget that. That's a public commitment that was made. And that was in exchange for opening the new shelter.
Mm-hmm.
Let's go to Dolores, followed by
Actually-
JD, then Roberta.
Actually, JD had his hand up before I
Oh,
did.
JD, I'm sorry. Go ahead, JD and Laura.
Just recent history. I sat on advisory boards of that hotel back with Christine Quinn. This goes back a long way. The most recent thing, and I think some new people on the board should know, the drug dealing in that hotel resulted in a stabbing murder on 46th Street with people who were from the hotel and living in the hotel. It was then that finally DHS and the city said, we will close it. This is 20 years of problems, drug dealing and murder. So the fact that the city has gone back on that trust, the fact that none of our electeds, as far as I know, are here with us to say, wait a minute. And it seems to me that the board is absolutely impotent to do anything about it. Yes, Katie will get a new provider. Maybe they'll be better, or maybe they won't. But where does the trust with something that we are told in this community, where is it? And what can we do? I'm just shocked of this blatant betrayal once again. Shocking.
Dolores, followed by Roberta.
So, the key here is why we know that it doesn't really matter who the provider is. The location is completely inappropriate for providing the services and the stability for temporary housing. The building itself, as Joe was trying to describe, the shared spaces, the antiquated structure of the building is in disrepair. And as we know, if you do not have a good space, as we learned from the hotels that were serving as shelter spaces during the pandemic, we know that the quality of someone's recovery, the quality of someone's ability to be able to be stabilized really diminishes. So this space itself is a problem. Joe, this is quite obvious. This is the end of an administration where every single agency has had to-dos, has had deliverables that they had to bring by a certain period of time. This is a space that was still open and available that they could check a box. And that is really why this is happening. What I've been very disappointed, and I think that this is something that, JD, your point about us being impotent is true because we don't have the support of our electeds that are currently in office at the moment. But we need to get an in with this new mayor, the new borough president, and our new council member, because the previous folks, with the exception of Gail Brewer, have just let things slide only because these are very difficult problems. They're not politically friendly to tackle. And what we really need to be doing is to sound alarms, not to be an alarmist neighborhood, but to sound the alarms that the trust is gone. And for us to actually help the city solve these problems, even though that's not our mandate, they need good partners in neighborhoods that know their neighborhoods, that can help pave the way to what are the right solutions. And I don't know how we're going to do that, Joe, but the key is literally sounding an alarm to every single position that's coming online in the next month.
Roberta.
Sure. So I did want to ask, you mentioned that the facility had closed. What happened to the long-term residents? Were they recited or are they still at the facility?
No, these are rent stabilized tenants or rent controlled tenants. They've been there for decades.
Mm-hmm.
I mean, that's one of the odd things here. We're talking about, this is somebody's home that has seen havoc brought into their home year after year after year, and they're mostly elderly too.
Okay, no, that's helpful context. And that would kind of answer, you alluded to this earlier, but is there any way to either pressure or push renovation or construction that would make this a better facility? I only ask because it's a contract. I fairly certain that there's not a ton that we can do about voiding the contract without some pretty strong reasoning?
The contract has not, there has been no contract executed for this. There has been a contract authorized, which is very different. And I think the thing that in our meeting with DHS that I brought up, which I want to hear the committee members to hear and understand, there is no incentive for the owner to upgrade anything, because with being the ultimate beneficiary of a city homeless contract, that's where he's making his money. We said to DHS the following: you need to do this contract on a short term, maybe 6 months, extension to a year. So there's an end to this, so this owner can be brought to the table, because you're correct, Roberta, this building should be acquired, it should be not for profit. There should be something that could be done to make it a useful piece of affordable housing in our city. But as long as we're paying tens of thousands of dollars a month or hundreds a month, why would any owner who is basically a long-term slumlord say, oh, I don't want to be the beneficiary of that? I mean, that's what I want committee members to understand the dynamics here. This is a private owner who has been truly getting city funds directly to his bank account through whatever operator was there, because they get paid on a nightly basis. And JD's right. I've almost forgotten about the number of drug arrests, stabbings in the streets. There was a whole period with the cab where all the residential buildings around them were out of their minds because there was an incident at least 3 to 4 times a night, and the building doesn't have adequate electricity for air conditioning. So people were told they could go in the street to get cool. It was the craziest thing. Like it's one of these things where, like, if you step back on it, you would never choose this location in this condition to help people to get through anything, let alone long-term for this period of time. So I'm happy, I'm glad I can sort of give you more information, because I forgot some of the horrible stuff. Any further thoughts, Roberta, on this?
So if the contract has yet to be executed and simply been authorized, what wiggle room is there?
We asked this question. We said, do it for a shorter period of time, and further make sure that there's a 60-day cancellation period in this. So in fact, if any solution could come up for an affordable housing, development, that we're not locked in. We want to get something that's permanent and good, not just money flowing in this guy's direction. So we asked that, and DHS said they would get back to us to see what kind of provisions they could put in.
All right, and it's an authorization of contracts in both cases, the Aladdin and the drop-in center, not an execution in either one. Okay, correct. So similar.
Paul?
Yeah, I share the general sadness at this particular bunch of occurrences. I was thinking back to when we had the great de Blasio genius idea of dumping the 2,000 folks to the shelters in our neighborhood with very, very little, if any, planning about the impact on the community, and the resulting year and a half, months and months. And at the same time, I was talking to a friend of mine on the Upper West Side, and the name of the hotel escapes me. That place at the corner of 79th and Amsterdam, I guess it is. Anyway, I was right down the block from them. They were astounded, shocked that one hotel would have been filled with homeless. They had never seen. You get my point. We've been living with this for 40 years. I've been living with this for 40. This over generous neighborhood that I love so dearly has not been treated well, and I don't know what to do about it, except to sound off to the choir that I'm preaching to. I don't know what else to do either. But I'm wondering, Joe, have we ever thought about any sort of legal action? I mean, the city went back on what they said. Are there no grounds? We don't have any money to hire lawyers. Isn't this a pro bono case for someone who wants to make a reputation defending neighborhoods like ours? I don't know. I'm just throwing out an idea. But who is the current owner of the Aladdin? I sort of lost track.
Alan Lapis. Alan Lapis was and always has been.
Yeah. Oh, he's been there in place. I see. So what was the procedure that unseated that fellow? I forget his name. The guy who had a huge citywide homeless racket. They just bounced him. I forget his name. I'm sorry, but he had the separate companies.
He wasn't a building owner. That was
nothing. Pardon?
It wasn't a building owner. That was an operator, and it was a corrupt operator.
Yeah, right.
So the distinction here, we have two levels of things talking about for the Aladdin.
Yes.
We have the fact that the city has supported a bad actor owner.
Yes.
Because it has a need to provide homeless housing and shelter. And then we have a political, it's not a legal commitment, it's a political commitment from a mayor who made a point to say something in public that this would be closed by a certain time and has now reneged on it literally in 2 weeks before he's out of office.
Yeah.
So, and I want to come back, and then Jessica, you're next. I want to just get people's thoughts about this general process.
Well,
my only
I'm sorry, Paul, go ahead, finish.
My only last thought, as I'm, all these other folks, I mean, the community board, we have a lot of people who are very concerned and we understand this. This isn't just research. It's not observation. It's not monitoring. We're living this. And if that message is not getting across, we need to find a better way to get it across, because we're doing more than we're trying to do more than our share. I like the fact that we have been as welcoming as we have been, but this is not the way you reward people who have done just that. I'm sorry to state the obvious. That's all. Thanks.
Jessica, followed by Josephine.
Well, it's a brief comment. If we had a chat, I'd probably just have dropped the article in the chat. But going back to 2013, there were articles about Mr. Lapis in the New York Times and about how he was amassing this business, specifically getting funding from DHS and running it as a business, which I guess there's no harm in doing, except that it's producing these kind of results. So just that when you think of people were saying like, what can we do? What hell can we raise to get attention? I think we have to really, the New York Times was writing about him and it didn't stop him. So just how we think about the techniques that we may need to consider using, I think really need to kind of stretch the limits here, because he's clearly not particularly concerned with having his name in the press.
Josephine?
Well, since it seems that these issues are not going away anytime soon, and there is mistrust between this community and DHS for, a variety of reasons, what would it take to, I don't even know if mend that relationship is even possible, but what do we need? What does DHS need to do to restore some level of trust?
Yeah, that's a conversation I wanted to start tonight, to think about what we could do, because I think we have another element. It's not just DHS, it's also the not-for-profit providers. In the case of Urban Pathways, they know us, they work with us for literally decades and decades. They didn't come to this board to say, we want to respond to this drop-in center open contract thing, or we want to respond to provide stabilization beds at the Aladdin. In fact, there was not a peep until DHS informs us there's a contract being let. So I think a two-pronged strategy is what we should be considering. First, our not-for-profit providers in the main are very good, solid operators. They're not horrible folks at all. I would suggest that the board write all of the not-for-profit providers stating, if you are proposing any sort of new facility, any sort of new services in our district, please come inform us and meet with us in advance so we can work with you to integrate and to work with those services on the siting. It's the kind of thing that makes sense because it's part of the community. How do people feel about that idea in general first? And I'll come back to DHS. So running around the room.
Joe,
Yes.
I'm just going to say outright, it can't be just something like that. It has to be giving context to why we're even doing it. It needs to be.
Oh, sure.
The letters, the letters that you outlined before that show the map of all the services, they need to see why we're raising the concern. Because again, for those newer people in some of those organizations, they may simply say, oh, it's another community that's not wanting to be helpful. I think it should be literally an invitation to review what they're already doing within their community, who else is doing something in their community, and invite them to go ahead and to brainstorm on how else they can serve their mission and partner with this community in a way that does not continue to do harm to their end clients and also to our communities. So I think it really needs to be more of an invitation so that it's getting them all on the same page of what we're already doing so that they understand that not in a vacuum They find a really great site and start that process without understanding what other hurdles they will have the moment they move onto a block that already has a lot of saturation.
Katie?
Thanks. I guess I would suggest a slightly different approach, Joe, because, and again, you know, I'm on the board of BRC. I don't know how these contract things work. I'm not involved in the program stuff of BRC or any other program. But my understanding is for a lot of these contracts, it's not the provider dreaming up like, I think I'd like to go open a place on that street. Let me just look into it. They're responding to requests by DHS, like, hey, we want to be opening a place there. Do you guys want to be the provider? So the idea of saying, hey, before you guys respond to an RFP or before you guys
Katie, it doesn't work that way, and it can't because of contracting rules. The DHS cannot say, we want to open something, do you want to be the provider? The procurement rules for the city are very highly managed, and they publish things all the time saying, we're doing this program or that program. And then the not-for-profits say, like there's some like open RFPs, they will apply through that. It cannot be DHS ever saying you do it. That would
no. I guess what I'm saying is it's not that the provider or the not-for-profit is like thinking about maybe going into a neighborhood and then could come check with us first. It's that they are typically responding to an RFP from DHS, right? So I guess my only thing is, I think we're missing how it works if we're saying, hey, providers, don't think about coming into our neighborhood, don't respond to these things without coming to us first. I think what would be really helpful is to say, to take credit for what we do here in our neighborhood and all the services that we have, and to say, hey, providers, you know, we are really savvy. We are very involved with supporting our neighbors. And here is our list of what we believe it is to be a good provider in our neighborhood. So if you're thinking about, if you're applying for one of these, and if you're thinking about wanting to come into our neighborhood, then here's what we would like you to do. We ask that you come present to us. And maybe they can't present. And I believe that there are rules about you can't present about something until, you know.
No, Katie, I've done this for a living for so many decades. It doesn't work that way at all. There are always RFPs and also requests for services always on the city record, right?
Right.
Providers choose, and social service organizations, what they want to do.
What they want to apply for.
Yeah, they always choose what they want to do.
Right.
Savvy providers will normally come to a community setting and talk about, we are thinking about X, Y, or Z. This committee has had literally hundreds and hundreds of presentations. And the role that we play, which is very key, is to say, X seems to make sense, not at that location. Or Y should maybe be changed and thought about this population, not that one. That's what we do for decades. That has broken down in this administration. It has never happened before. This hasn't happened. It's not, we're not like coming up with a new idea here.
But I think that I think one of the reasons it's broken down is because it's actually not quite, as we know, I mean, obviously there were COVID issues and other things, that they were moving in a different way than the way it had happened in the past. All I'm saying is, my suggestion is, let us say, everybody, if you're thinking about coming into our neighborhood, here is our list that we have written about what it means to be a good provider. And these are the kinds of things that we would be looking for, that we want to make sure that you have, you know, what the space is inside and how you interact with the owners, and what about the bathrooms, and you know, what about the services you're offering, like all of these things, and are you monitoring the outside, like all of this stuff. I think we should have it written down and ask people, like, instead of, I don't think we want to be threatening lawsuits or doing anything else.
Kate, can I just say for a moment here, in this committee discussion, no one has threatened lawsuits. No one is, in terms of the committee, an individual can say something. That's not the tenor of what we're talking about.
Right. Okay.
Before I get the JD, I want to break this down to a few pieces. This is going to be some work. I want to say it's going to take us a few months as a committee.
Mm-hmm.
It's not a day to do this. I want to open up this discussion tonight, and then, like we did with inclusionary housing, talk about it in January again, and probably in February. And there are a couple of outcomes. First is, like we have the inclusionary housing checklist, I'm going to ask a small group to work on the same kind of thing for social services. So when we get a proposal, we all get the same friggin' information and don't have to work so hard to extract from the providers. So they have to fill something out, be clear about it, and talk about it. I think everyone's nodding, saying that's a good idea, right? Is that an assent? Yes. Okay. The other thing is, I think though it's important that we certainly by the February meeting, just put a marker out there in the public. Hello, not-for-profits. Hello, social service people. We are in a crisis because we're not coordinated with anything. We need you to be aware. Don't just go, and I say this in the colloquial, and that's how I would write it. Don't go applying willy-nilly and then come and tell us about it. Please talk to us about location because it really matters. Dolores's idea of the map, to sort of make that very public, to say, here's all the things that exist. So please come and talk to us first as we go through this process. JD has his hand up, and then we'll go back to the rest of the committee.
I am very concerned about the lack of the betrayal by this city continually with this community board, the MTA site, the DEP site, and now this. This was a commitment by the city. We are a welcoming community, but at some point, when we say this is destroying the community, and the city says, okay, we'll do something about it, a year later they break that commitment. I think we should write to our electeds and saying we are a city agency. We feel we are acting honorably, but the trust between us is being destroyed, and we want to know why and what we can do about it. It's all good to talk about the providers, but where are the electeds? And I think, Joe, we need to raise that issue with Eric, with whoever's representing us now, and saying, going from here, how can we trust anything that's said?
So I want to get to some of the committee members who haven't spoken yet. Sabrina, your thoughts about this whole idea of responding and trying, because I'm focused on the not-for-profits and the agencies mostly.
Yeah, I mean, I do think a checklist, it's the way to make it, again, I'm thinking about BLP and sort of the exemption, yes, that we have from them. And it sort of create a standard and best practices. So I think that's kind of the way. I mean, I think it's too early to really have I think I need more thought of it, but I think a checklist is the way to start.
Roberta?
So I did, if there is any sort of written communication, I know that there's been a focus on the community, but I would just caution that that can sound in some instances a little NIMBY, even if it's not in, and that's not the intention. I don't think that that's the intention, nor is it the tenor of the board here, just a caution. And I think that there's a really strong point, particularly with Aladdin, about the condition of the facility and the well-being of the potential people who would be residents there, and their health and their safety. And I hope that we can raise that and make that an important point to any future electeds and current electeds that we might be lobbying on the issue.
And I think that because this is going to be, any letter we write outside of the checklist is a sensitive discussion, I'm going to suggest that we take it up again at our next meeting and really have some draft to kind of mull over. So it's not just we talk about it and then it gets written, because we really want to, it's the wordsmithing in this, I think, is super important, in how we manage it. Other members who haven't spoken, Josephine, anything further, or Betty or Hector? Oh, Leslie's got his.
I would agree with what Roberta was just saying, that, we see that violence is happening in these service providers to people who are actually staying there. So the question is how do we keep them safe too? Because obviously if they're not keeping them safe, then, what can we do? So I think to start from that point makes a lot of sense to me.
Leslie?
As you know, we had the same issue with our neighborhood
lantern.
person, the lantern. We had those tenants, former tenants, being assaulted by the new people coming in. But I think we need to focus on the electeds, especially the new mayor, and write a letter from the chair, of course, to maybe establish a meeting of sorts where the chair, if it's just the chair and the assistant, can meet with somebody in senior level of the mayor's office to really discuss this whole issue for this area. And also with our new electeds for this area, we need to sit with them and discuss this.
Any other thoughts, Betty? Betty's not on. So the idea generally is that we'll draft something just for the committee to consider at our January meeting as we figure out how to do this. And I think it's a two-pronged approach. One definitely is this checklist, and that will take probably longer than January. So we'll put a few people on that to engage with it, modeling on BLP and modeling on the inclusionary housing. And then we probably want to do some sort of general broadside to DHS, write it in January saying, I don't know how to say you can't be trusted without being rude, but I feel like that's kind of where we are with this. If you say X and you do Y, what do we do? So, and then definitely seek to have our electeds get involved in this with all the new crop we have. We have Hector? Yes.
I guess my question is, the checklist is a grand idea, but what do we do about enforcing it somehow? What is the downside? What repercussions do we offer to, individuals that don't at least try to make a really good attempt to meet the checklist or be a good neighbor? We've gotten
Hector,
rejected,
Hector, social change comes slowly. When we first did the BLP checklist, people didn't want to do that. And now it's considered like you just do it, period. And it's the information. At least by getting information down in a clear, open manner, we'll smoke out some of the possible problems. And that may be useful, as it has been for State Liquor Authority to understand. It may be useful for DHS or other DOHMH. When someone fills out something that is kind of bullshit, it exposes, it makes it transparent to the public. I think that helps. Just to start, I think we have a lot of 2022 to work through on this. Paul, and then Betty.
Sorry. Yeah, I just want to make it clear. I am not a supporter of the departing mayor. I would certainly not like to have this story end with this little December surprise of his. There was the COVID surprise. There was the let's put the homeless people into 80/20s with no social services surprise. He's just the most surprising guy. I'm sure that the voters of New York will recognize that one if he ever runs for anything ever. But I always like the fact that this committee and my community board and the neighborhood in general usually proceeds in a rational and even-handed way. Joe, you're a master of it. You've been doing it a long time. That probably is the best way to actually get a result. But I don't really see any advantage to, pretending that someone's not urinating on our leg and telling us it's raining. So I would love to hope that there's a perfect time with the new administration coming into office. I don't know much about Mr. Adams. He seems like a pleasant enough sort. I'm fascinated about the bubble baths. That's a whole nother story. I think this is a great time to try and get our foot in the door with the new administration. I'm cautiously hopeful that some of what he says he's going to actually follow through. And I don't know his political record really at all. The problem is that we're an advisory committee. All community boards are advisory. But right now, we're either being told that everything that we know, they know better, or they just don't care about what we think we know after doing this for a long time, or both. Somewhere, somehow, it's got to be publicized.
Paul, I've never heard the de Blasio administration so summed up in 2 sentences.
Thank you very much. I appreciate that. That's all. The story's not getting out is the problem. And I'm sorry, I don't remember who said it, but it's true. Anything on this topic, when people are just we're calling for a rational approach. And it will be labeled as NIMBYism by people who don't even know what the acronym stands for, much less what it really means. We know what it really means because we live it. It's just exasperating to feel that this story is so one-sided. We're not getting the story out, I guess, but your approach is the right one, of course. I just wish there was something that we could, some little bouquet we could give to Mr. de Blasio on his way out of town. That's all. Thanks.
Let's go to Betty, if there's anything to say, and then end with Maria.
I have a particularly tired brain tonight, but think people have said all the right things. And I think that we should get our newly elected officials involved in a big way. I don't know whether you pick them off one at a time or whether or not, you have it as a group thing. Somehow I don't think letters we can send letters, but I'm feeling very powerless about the effect of our letters. So maybe some strong words need to be said to
never feel powerless, Betty. Truth and information actually creates a lot of problems for people out there. Think about the little Port Authority thing we've been involved in, which is knocking down all kinds of blocks, and now we've moved it, and it's an entirely different project.
Yeah, but
a lot of letters.
But we did demonstrations. We had all the public officials on our sides. We were standing on the corner. We were getting press. We did a full body press. We had town halls with 100 people in them. That got the Port Authority to see what we were doing. So I think sometimes when we have this continuous conversation, we need to go out and do something big.
Maybe we'll get out of our Zoom boxes in 2022. Not right now, it seems, right? Maria, any final words? And I'll just do a quick sum up, move on to the next item.
No, I'm feeling like Betty, a little bit distracted, brain. I agree with what she was saying, sometimes feeling hopeless, but Joe always helps and pushes me along. We can do this, we can get this done. We have more power than we realize. And what I was thinking is, we've talked about this already. I think it's a good idea that we do that. I like the approach. The only thing I feel slightly uneasy about is if related to the Aladdin, I know Roberta and Josephine mentioned it. I think it's a good point to make regarding the building, but it reminds me of, which leaves a bad taste in my mouth, of the Billionaires Row situation, where folks didn't want the shelter across the street. And what they did was, in essence, they basically said it's an issue for the residents who were going to be having temporary housing in that building. And they made it about that, when I don't think that's really what it was about. So it just, I think it's a valid point, but I think we need to focus on what the other issues that have been documented in the letters that we've written before. And there was one more thing.
So by the way, I'll ask Nellie to send out all of our old Aladdin letters. You get the flavor of this, how long it's been going on for. So I was going to ask the following people to participate for the social service checklist. Could I ask, working with myself, Maria, Katie, and Sabrina, and Roberta, because you're fairly newer members of the committee, to participate in that? Is that possible? And then you can really sort of run with it to use our inclusionary housing / BLP stuff as a base to modify together so we can get this going, at least have a first draft of it by our January meetings. Does that sound possible? Great.
Joe, I sent an email to them actually already, and I think I included, just FYI, a few days ago. Or last week, I included Leslie Williams in that email also.
Perfect.
Just FYI.
The more the better. It's got to move along so it happens. Okay. So thank you all very much for the discussion. And again, new mayor, new year, new administration. Let's see what we can do to make the situation better than just feeling as if nothing they say can be trusted. Our next item is the inclusionary housing checklist, and we have the revision. I'll put on the screen. And this will be the third time we've seen this. So hopefully we'll bring this to conclusion tonight. This is the form that was sent, and I'm only going to go to the parts that were changed from our last meeting to incorporate the input from our last meeting. So this came from Betty, that we note that affordable market rate or mixed affordable and market rate, just so it's clear that it's all kinds of housing that can be built, and it's being, and it's that, so we get understand what their past projects are. Again, the same kind of thing, voluntary inclusionary housing or mandatory inclusionary housing, so we know what the various flavors are. And then affordable New York, because we had that in projects where we mixed both the permanent and the temporary. Because anything that's not changed was here from the last meeting. What district you're in, the location, what is your period of demolition, construction, marketing, and leasing. Then we say, here are the types of housing that can be built, and we dropped in the current income bands. This will change every year as we have, it's updated by HPD. And we'll also make something clickable here that can go right to the HPD website so they can verify it. Then we ask them to say, list your apartment numbers by the various AMI bands. List your affordable units by the various apartment sizes, studios to 3 bedrooms. Then give us a breakdown by AMI band and apartment size, how many units of each income band. Then we just, again, give the rents from the HPD website. Then say, what are your proposed rents? So as Roberta probably knows, these are the maximum rents, but developers and different projects can have rents that are somewhat lower depending upon negotiation with HPD. So we want to know what those actual rents are, not just the HPD maximum rents. For the mobility and the ADA units, we have an appendix now that says list your units so we can see it and not get confused if it's this flavor or that flavor of ADA units. For distribution, we have an appendix also, and it says list everything out in it. But I'd like people to look at this one section, which is we came up at our last meeting about the finishes, and see if this adequately addresses our discussion. MCB4's inclusionary housing policy ensures no discrimination exists against affordable housing tenants by providing the same apartment finishes, fixtures, and appliances between market rate and affordable units. Is that accurate from our discussion from our last meeting?
Joe, I would just suggest changing the same to identical.
Anybody else on any?
I'm sorry, I'm
comments?
a little concerned about identical, that does not get misinterpreted to comparable. I think the same means the same. It's the equal thing. If you say identical, I guess it means the same thing, but I would just worry, Katie, that they would modify that. So Katie, do you think they would not?
So actually, JD, that's what I was trying to prevent against. I think you could argue, well, yeah, it's the same, you know, and whereas I think identical means truly identical. But so anyway, I think we have the same concern. We're just trying to address it.
Good, good.
All right, so let's leave the word for now, and I'll do some little wordsmithing thinking about what could, I'll send it to a couple of people saying, what do you think this means? How's that sound? Okay, then we have them list. It says if they're not in compliance with that policy, list any variations, and they have to list them. Tenant amenities. We said, this is a change, that it'll be available to both market rate and affordable housing tenants at no fee, except for gym, health club, or pool, because in those cases, they have to be staffed, those items normally. And in gym, health club, or pool use, provide the percentage discounts for affordable units on a sliding scale. Is that consistent with our discussion from last time? Yes, okay. And then we say, list the amenities and check them off, yes, no, whether it's subject to fee. And then the fee structure. Can I just ask a quick
question, Joe? Sorry.
Yes.
In some buildings, aren't there like, I don't know, children's centers, or I don't know what you call them, playrooms, but they sometimes are staffed or something, right?
No, they're very rarely staffed.
I get rarely, but I'm just wondering,
No,
like
but
up above where you said only those things.
Yeah.
I'm just wondering if
In my experience, Katie, coming to the committee, we've only had staffing at a gym, a pool, or a health club. There's never
right.
been
And then that
something
last
that's-
one, they were talking about like the fancy, I don't know, space that you could maybe have parties in up on top.
Party rooms or event rooms.
Right,
Yeah.
and I think we want to say enough of that. Like, I mean, that's just bullshit. It's a room, you know?
Unless it's being staffed with an event.
No, they're never staffed. They're like a rental room. They're never staffed.
Okay, so are we saying that
you rent a car.
we're telling people never to have any event rooms, or that we're saying that you can never charge a fee for an event room?
Correct. Latter.
Charge a fee, right?
Yeah. In other words, here's the thing: is that it says if you have any sort, except for the staffed items, they should be open equally to all. Period. And if you have, let's say, for example, if you have a fee $100 for use of some lounge room, then it should be one fee and that's it for everybody. It's not like there's a separate class, which we're trying to get rid of the separating of class here. And let's think about it more and talk about it, because that's our intent. So what are some thoughts about that?
This is Jessica. I mean, I just think the sliding scale should apply to everything. Some buildings do charge. I've rented those rooms at other buildings. That's a service that should be available to everyone, just at a sliding scale.
So we should add the event room onto the gym, health club, or pool use.
Anything that's otherwise available, like it should be equally available. Anything that's available to anyone should be equally available and at a sliding scale.
Right. The problem is, as one of the developers explained to us, even their sliding scale cost was going to be too much for people to afford, which I find hard to,
Well, maybe then it should be a percentage of people's rent. Like if the room is $150 an hour for the average tenant that pays $3,000 a month, then that would be, I can't do that math in my head, but like, let's say 1%. So it should be 1% of someone's rent.
So
I don't know. I need to think that through, but.
Yeah, we have to add in here is that this was totally focused on if you join the quote XYZ club, as opposed to a one-time rental. So I think we should add another section for that, because there are those one-off things. You rent the lounge, or you rent something for an event. So I'm just making a note to add a section in on that.
you could call it event space.
Yeah, I'm going to say event space or community room.
Or community room.
But in general, for the overall thing, we want to make clear that they should not be closing, because we say further, outdoor space is open to everybody. That there should be nothing where outdoor spaces that you have to pay a fee to use the outdoor space. You noted that again, I didn't see it. I remember the committee basically saying all outdoor space should be open to everybody at no fee. Is that correct?
Yes.
Okay. All right. And then we have marketing materials. Jesse notified us that he will manage this from the district office end, and that he will give them a list of all the community organizations and block associations for notification when there's apartments available. Employment opportunities, we asked them to provide a hyperlink. We asked them to provide perimeter lighting and street tree plans. That's often discussed, so let's get that in advance. Sustainability is another appendix. And trash removal, we asked them for a floor and site plan for trash removal and storage. Come up with a lot of things. Now we're going to ask them for it in advance. Is there a plan for public art? We ask that frequently. Ask them for that in advance. And then they are going to sign saying everything they put on this form is true and accurate. And we then go down to the.
Joe,
Yes.
can I ask a quick question?
Yes, Leslie.
At one of the meetings we had recently, there was a discussion about a building near the Port Authority or Penn Central, and it would be demolished, and there were people who were living in it who would have to be relocated somewhere else and then come back. Should we be asking the question, whether or not that person who comes back is coming back at the previous rent rate, or, you know, is there impact along the way somewhere?
Right. So we have never had a single inclusionary project that was a building being demolished. It's always new. That was residential where tenants were being displaced. You're referring to the Penn Station reconstruction, yes, where there's some condemnation happening by the state. I think that's more appropriate for that, but maybe we should just ask a general question. Are there any residential tenants? Is anyone to be relocated? As just a general question here, which we've never had before, but why not ask it, right?
Two questions, Joe.
Yes.
The trash, could you go back to the trash? Are we talking about the outside collection as well? The building?
We talk about floor and site plan. So okay. Site means outside the building.
Gotcha. And I'm sure I missed this, but in terms of the affordable apartments laid out on the floors, that they're distributed equally.
Yes, and we asked them for a chart by color coding. We've never done that before.
Is that in there?
Yes.
Okay, thanks.
And then we get to the appendices. The first one is for the ADA units. I have to list everything so we'll know where they are and not have to hunt and peck to find them. Distribution of affordable units. Attach a stacking chart color coded by market rate and AMI band. So now we'll be able to see it's this AMI band, that AMI band, and that'll tell us also the next one is the plans. And the plans will say the same thing. So we'll be able to read it carefully. Listed for community notification. And then sustainability features, a list, and put the information in the Dropbox. And that's it. I mean, I think we've gotten very comprehensive now, but I'd like to get a quick sense around the committee. We can bring this one more time in January, and then we can adopt it in February. Does that sound good? Yes?
Yes.
Okay. So therefore, the charge I give to the folks now going to do the same thing for social services. It's going to take a couple of months because we got to go through it, think about it, add on, put all, whatever. And I think, but let's say February we're adopting. Okay, so we'll be in good shape. Also wanted to note that the new board chair has definitely asked that we take up amendments to the affordable housing plan. We'll start that in February. I'll ask Nellie to send it out. It's on the website. It's 123 pages, so it's not going to be done in a day. We want to do it as soon as we can. Some things are simple. Buildings that were into construction are now built, things like that. Certain projects just are not going to happen. But anything else we want to put in here, we want to think about it really to get it done. And our goal would be to have that adopted, truly probably discussed in January, discussed in February, adopted in March. Okay. Maria, what's our last item?
Our last item is about the family shelter closures that were in our district.
And again, DHS not telling us anything. Here we are. That's all.
Yeah. And the reason how we found out actually was, I believe, Josephine, she was working with the CEC, I forgot what CEC stands for, Josephine, or
Community, yeah.
Thank you.
Community Education Council.
Yes, I knew education was the E, and she was doing a toy drive. Josephine, you can share really quick, really briefly if you like.
Right, so we were doing multiple toy drives, and Acacia wanted to do something special for the kids, and we were setting up a call, and then I just got this last minute call that she just basically somebody at Acacia had gotten off the phone with DHS, and the families were being moved out within the next 2 weeks, which is just shocking right before the Christmas holiday.
And no notice to them.
Yes, no notice at all. And I just want to go back to something that we were talking about earlier in terms of our working relationship with DHS and this letter that we may send. And, I am looking at it from, that the DHS and these service providers have to treat these families with some dignity, these adults with some dignity, and we're not doing that. So regardless if whatever was said in the Billionaires Row letter, I'm looking at a point where we need to keep reiterating that, because this is very important. They're not treating these families with any dignity.
Right.
They're not treating us with any dignity. So it's very important that we keep that in the letter as well.
So
that's all I have.
if they're not treating us or the clients with dignity, what the hell are they there for? I mean, like, that's part of like the basic issue that people need help, and we're all going to work and row in the same friggin' direction. I don't know.
And these families have been through so much. They were a part of our schools, and no consideration was given to that at all.
So just.
But wait, before we go there, what I want to say is, I want to go back to Dolores. This is the mayor checking a frigging box.
Right.
That's all it is. To be able to say by year end, and I closed these hotels. It doesn't matter that you move people in, you move people out. I mean, Maria can attest to this. I can get pretty impassioned. I got so intensely frustrated in this discussion with Molly Park and Erin Drinkwater from DHS last week. I said, you are just turning our neighborhood inside out, that people don't want to be accommodating to social service needs through your actions, not through everything else. It's your actions on how you handle things. And here's another case of where, to make some numbers, these are families. I think it makes sense to move families out of hotels, of course, right? But do it in a way that you engage with people back and forth and community. Let's do a major toy drive as a way out and have it happen in January, whatever it is. You talk about it as opposed to another fiat.
But unfortunately, I've heard that the tier 2 shelters that they're being moved to in the outer boroughs are worse than the hotels. You're right. This was all a political move at the last minute. They didn't care where these families were going. Just get them out of the hotel so we can say that we did it. Because honestly, if those shelters could have provided better services, they would have never had the families in the hotels to begin with. So
I mean, I was floored that in 21 items that we sat through in that mayor's office of contract services, we literally heard $600 million of contracts being approved on December 16th for periods of up to 10 years. That's pretty shocking for an administration. I'm sorry. It's like, let's just throw money at it and see what happens. So I'm sorry. Yeah, Sabrina, go ahead.
I'm sorry, I missed the address. So where are they moving?
According to DHS, if you look in the Dropbox, you'll see the email that we received on December 3rd informing us. You'll also see the letter from DHS to the families that was dated November 29th, okay? Telling them that they're moving within the next few weeks. They don't know when, they don't know where, but that they'll end up perhaps in permanent housing or perhaps in another shelter. I don't know the numbers on where families went, how many went into permanent housing, how many went into shelter. My guess would be most ended up in another shelter. I think the thing that's really disheartening and that was really upsetting for me to find out about that is that in New York City, homeless children by default, who are often children of color, have high rates of absenteeism. And to move them in the middle of the school year, you're already dealing with a family who has issues with stability, right? If you're living in a shelter, it's just hard because you can move around every 2 weeks or so. I don't want to get into the details. The point that I'm making is that it was just really upsetting to learn that families are being relocated. It's not okay. It's not okay. It's not okay that they had to do that. And I don't know how that decision was made at the top at DHS. When you talk about vulnerable populations, you talk about you care about people. It's people of color. And we have this thing about Black Lives Matters and all this nonsense. You show it in your actions. And when you do that to families and uproot them from where they are and their schools, that's not okay. So I was just really upset about it.
So the locations where the travel in were the West 39th Street between 8th and 9th. There were 2 locations there. And is there a third one too, Maria?
I'm sorry. There was only, that's what I meant to share as well. My understanding is that there was 2 of them. So there was the one on 39th Street and the one on 42nd. Yeah.
Right, and traveling, right. So again,
can I just share something personal?
Maria, can I chime in right before that? I want to echo your opinion really quickly.
Yes, thank you, Travis. Go ahead. Maybe I don't need to.
Someone that provides services to the students in the schools and the population that Maria just spoke about in particular, many of these students may have received their first social worker or first adult that actually cared about them and provided services to them and created some stability in these last few months.
And to uproot them in the middle of the school year like this to a location they don't know only adds to their cardiac absenteeism and adds to their trauma. This is completely irresponsible.
And thank you, Travis. And I think what I just wanted to share, I think part of where TMI, and I know this is public and being recorded, I think part of where my passion comes from is the fact that when I was a child attending PS33, living in my grandmother's house, in order for us to get an apartment, we had to move into a shelter. We lived on a shelter on 23rd, right off of 9th Avenue. But from there, we had to move to a shelter called the Saratoga. I think it's still open by JFK Airport, and I had to travel to school to PS33. It is, when you are dealing with a family that has issues already, and then to have to do that to them and expect the children to do well and go to school, it's just, I don't understand. I don't get it. And it's just really upsetting, and it's not okay.
I think it's terribly upsetting. And also, these are members of our community. These are members of our community that are being moved around willy-nilly. Where are our electeds on this? Why aren't they protecting and defending those people? Why? Why aren't they? I'm asking you.
Part of this, JD, well, none of us even knew about it. Again,
why don't we know about it?
And the plan is, we didn't share what the plan is. The plan is that they're going to be sites instead for adults.
Right.
The provider is going to be Acacia. And I've decided that I am going to have to utilize my networks with these organizations and these providers that are coming in to have discussions with them and maybe create cabs. So I'm hitting some of you people up to deal with any issues that we have.
So I want to go to Roberta
anyway,
for a moment. Yeah. Let's just reflect. Let's make sure now we move families who are getting some stability from our neighborhood and replace them with singles. We've had no experience with a lot of single people with social service problems, putting them in hotels that are not suitable for shelter. Like, let's just replicate our disasters of 2020 and 2021. It, to me, is like, I can't wait till there's another commissioner. Yes, Roberta.
I assume that there's no letter that we would want to write about this, because it does seem like quite the issue. And I think a lot of people feel very passionately. To add one additional point is, it was not always the case, but schools in Hell's Kitchen and Chelsea are often better resourced than schools in other cities.
Now they are, yes, now they are.
It was not always the case until quite recently. And so I think it's also an equity issue when you are moving people from a moderate to wealthier income neighborhood that is in better resourced educational opportunities and other opportunities, and then moving them away from that. That has serious equity implications. And I think if there's any way to sort of put that out there for the agencies to hear from us, I don't think it's helpful.
How about just a plain old how you manage anything issue? You think about the people involved on all ends, and you consider what your actions are on the results on them. So don't move a kid 2 weeks before Christmas. Maybe wait for a holiday. Maybe plan it, figure it out what to do. This is just constant. We are preaching to our own choir. Dolores, why don't you take us home on this issue?
Well, before that, Leslie had his hand up.
Oh, I'm sorry, Leslie.
No problem. Leslie, your brown hand is not as visible as my bright yellow hand. My bright yellow hand.
I'll do a yellow hand. Sorry.
You know why? Because you have a lamp right
I'm not telling you not to. I'm making just a comment on colored hands. That's all.
Oh, all right. There you go. No, my question, Joe, was: do we know who's replacing Steve Banks?
No, we do not.
No.
Okay, because I think that's somebody we need to zoom in on. Yeah, I mean, we've got to do some quick
Unclear if
movements.
Steve Banks is being replaced, though.
Yeah, it's not clear.
When did that change, Jessica?
Just saying it's not yet clear.
No, but when did that change? As of last week, he was.
Oh, I read that he hadn't said he was or wasn't.
He, to my knowledge, he requested to stay,
resign,
and the offer was declined.
Oh, yes,
I guess. Okay.
We will see. We will see.
Dolores, you're wrapping us up?
Yeah, I mean, what I think is really key here is clearly, we're Housing, Health, and Human Services, and this is it hits those buckets. But I think it's really important for us to connect with our ACEs committee, as we already have a few of the members here, including Josephine, because I think a great ally would be our educators who recognize the extreme duress that our young homeless students have, and they see that firsthand. I know that principals, including the principal of PS 111, has noted this, that this is a continuing problem. I think that we need to talk to the co-chairs of that committee to think about how do we, if we can't move the levers through DHS, how do we go ahead and leverage the Department of Education to really shine a light on how this is a barrier for our students in terms of being able to excel, because we're not supporting them when they do not have stable housing.
I would
remember we have a new 100-bed family shelter open.
I would second that, Joe. I think they moved out of the skyline. This was also a terrible including of families.
Oh, yeah, it was.
I would ask Maria, is there any way that we can make a list in our district of those families and children that are being housed, and that we can connect with the educators and our electeds to try to prevent this from happening again, or at least to raise a fuss if it happens again?
There are no other sites in our district.
Oh, there are none.
No.
No, we have no
And then-
families.
But I
with
say to the
children
members
in our
of
district.
members of ACES, it's important. There is a new family shelter opening at 440 West 41st Street. This is going to be over 100 families. We need to come up together, maybe joining the two committees with a plan, engaging with the operator. So in fact, those kids coming in get properly integrated into schools and don't get buffeted around. I mean, this is a thing that we should, and I don't think DHS is thinking about this, honestly, so.
Oh, and can I just add something? This move is supposed to happen by December 31st. So I don't know exactly when. Josephine probably has a better handle on it when it actually occurs. And the other thing,
some kids have moved already. I mean,
Yeah,
some
it's
families
happening
have
right
been
now.
moved.
Right.
Okay.
Yeah.
Okay.
It's happening.
The other thing is, I in DHS's email to us, it mentions that the mayor had this 5-year plan where to get everyone out of the hotels, but the children, I think they could have at least finished the school year where they were. It was just really a poor decision on the part of DHS. It really,
Josephine
really
and
was.
Maria and Sabrina called it. This was a political, it's cynical as anything.
Yes.
It's nothing about really,
yes.
It's like, it's a checkbox. Well, we've had a lovely committee meeting tonight, say everybody. Talked about some serious things. We're trying to move some policy stuff along. And as a recap, we'll settle up on inclusionary housing at our next meeting. And then we will really start the hard work on the social service sort of checklist going on and begin to discuss our housing plan, affordable housing plan amendments at our February meeting. And again, thank you all for hanging in with all this as we get to the end of this administration. There are only 15 days left. So we're doing good. Happy holidays, everybody.
Happy holidays. Motion to adjourn.
Yes.
Happy holidays.
Happy holidays.
Bye-bye.